what happens to the younger women, right? Because in our support group, in our BCH support group, or when many the women reach out to me, most of the time I find that they are very young, like 35, 37. This is a very recurrent age that I'm seeing. But what do we tell them? And also, when in urban India, when I thought of first starting breast cancer, my point was that if I'm going to these different places and I'm using this big versus mammogram, this will never work. So I have to give a solution. So that's when I felt that whatever the doctors are doing, the clinical breast exam, in the same way, we collaborated with the Sarah Cannon Cancer Institute breast oncologist and Male Breast Cancer Coalition. And for the first time, we brought a breast cancer self breast exam card for men and for women. And this is in a very simple way, like how we can save ourselves. And this is the simple step that you need to practice at home. Now, when doing that, my concern was that, I'll talk about it. Like if I'm going to the villages and I'm giving it out in English, this will never work. So I'm so thankful to our breast cancer hub volunteers for helping me to translate this. Now we have it in 24 languages, and this works like magic. But then how to do the breast self exam? Is it that, I suddenly remember today and I'm going to start doing the breast self exam? That shouldn't be the case. So how do we do it? Basically, 7 day post our menstrual cycle. Like if we start our period today, 7 day from today, we have to do a breast self exam. Now, and for the women who hit menopause and for the men, we just pick a date in the month and we do the same practice the next month, the same day. Now, in a sitting position and in a sleeping position, many breast cancer survivors told me that, like the heart flow worked very good for them. So what do? We stand in front of the mirror, we take our hands behind our head, and we look for any abnormality, any discharge from the nipple area, any swelling around the nipple area, any parts like any redness, any pimple, inverted nipple, like if there's a sudden change, sudden inverted nipple, then skin irritation or dimpling of the skin. Like for example, if you know the orange, like the skin of the orange is dimpled, so something like that suddenly happens, or redness, scaliness, or thickening of the nipple area. So these are the concerns. If you feel something like that is happening, immediately report to the doctor. The next thing is we take our hand behind our head and we start to examine from top to bottom. We have shown this in an arrow, but we also have to remember that the collarbone area and the underarm area, which is very important. When we are talking about breast self exam, it's just not the breast area, but the full chest area. We really examine it very well. And what do we expect if you're feeling something like a marble, like a mustard seed marble is slipping from a finger? So do not panic, because 95% times it will be benign, which is non-cancer, but 5% times if it is cancer, it's always better to be safe than sorry. So we just wait for a few days, and if we see that no, the symptoms are not going away, the lump is becoming sturdy, we immediately report to the doctor. We go, if we are young, probably they will do the ultrasound, then we do the imaging. If we have dense breast, we have to do additional ultrasound.